You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello and thank you for joining me and welcome to the Dental Zone podcast. I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. And in these podcasts, I like to talk to you about mouth-body connection, oral health and how that impacts on your systemic health, what you can do to have a healthy mouth for a healthy life, and the impacts of dentistry on the health of your mouth, teeth and gums, but also on the rest of your body. If you'd like to know more, you can hop on over to holisticdentistry.au or check out my dental office website, evolvedental.com.au. And of course, if you're in the Brisbane area and you're looking for a holistic dentist, then give us a call, 0737 201811. In today's episode, I'm going to talk to you about fluoride and its impacts on your endocrine hormone system. I'm going to talk to you about why I don't think you should have fluoride and the implications of it for your overall health and well-being. So let's get to it. Let's get in the zone. So, fluoride has been touted as the panacea of dentistry. It was going to be the thing that was going to revolutionize our dental health once and for all. And it was going to be the magic potion that was going to stop tooth decay. Well, water fluoridization has not worked. Fluoride in the toothpaste have not worked, and we are still seeing people with tooth decay. A lot of countries in Europe, for example, dropped their fluoride programs because A, it was too costly, and B, it wasn't having a great effect. Dental health was not changed, and C, there are health implications and concerns about the use of fluoride and the ingestion of it into our body and its potential for ill and adverse health outcomes. There are studies that have raised concerns, for example, about the use of fluoride on your pituitary gland and its impact on your pineal gland. Research has shown that fluoride causes issues with these important endocrine glands that are responsible for playing major roles in regulating your body's functions and general health and well-being. The pineal gland is referred to as the body's master gland because it controls the activity of most of the other hormone-secreting glands. Now, if your hormones don't work properly, if your hormones are out of whack, you are going to have some serious health problems. So let's have a look at fluoride and its effect on the pituitary gland. Now, fluoride can lead to low levels of thyroid hormones. And this causes the pituitary gland to release more thyroid stimulating hormone, TSH. And this can cause health complications. Now, why does fluoride have an effect on your thyroid gland? Well, fluoride and iodine, so fluorine and iodine, are from the same chemical family. They are very similar to one another. And iodine is responsible for proper thyroid function. And fluoride will interfere with iodine's ability to produce hormones in the thyroid gland because the fluoride will get preferentially absorbed over the iodine so the iodine doesn't get to where it needs to go. And if your body can't produce enough thyroid hormones or respond to your thyroid hormones, you can develop hypothyroidism, which can create a lot of adverse impacts on your health. So let's look at fluoride and the endocrine system. Now, the endocrine system is made up of various organs and structures in your body that produce hormones. Your hormones are chemicals that act as messengers across the body, and they influence the function of other organs and structures. Now, fluoride affects two major glands in the endocrine system, and these are the pituitary and the pineal glands, as I have previously mentioned. And this can affect various hormones and have hormonal effects. So, thyroid stimulating hormone. Fluoride affects the production of your thyroid hormones, and then it drives the pituitary gland to release more TSH, which stimulates the thyroid gland in an attempt to get it to produce more thyroid hormone. So everything's out of whack, essentially. Melatonin. Now, your fluoride will accumulate in the pineal gland, and this produces melatonin, which is a hormone that is responsible for establishing proper sleep patterns. And fluoride reduces the amount of melatonin production and can affect not only your sleep quality, but your sleep quantity. Fluoride can impact and reduce on your sex hormone production, and this can cause problems with fertility and puberty. Fluoride will have an effect by blocking the function of the pancreas, and this can affect the insulin levels in your body and how your body controls blood sugar. Also, fluoride will have an effect on the adrenal glands, and this can decrease the levels of another hormone called cortisol, which you need to be able to function properly and have energy and deal with stress. And without proper cortisol production, you can end up with chronic fatigue. So you've got chronic fatigue, and you've got low thyroid, you don't produce your melatonin, your sex hormones are all over the place. You can imagine what an impact fluoride is going to have on how you feel and on your health and well-being. So why are doctors and dentists in particular advocating fluoride if it harms your pituitary gland, if it harms your pineal gland, and has such a devastating impact on your hormonal health? Well, they say, look, come on, it has its place in keeping people healthy. Bullshit, bollocks, rubbish, crap. Sorry, I'm not going to hold back on this. Fluoride has no place in keeping anybody healthy. I would argue so strongly against this case, and I do. Check out my other podcasts on fluoride. Go check out the videos on YouTube. Fluoride is not an essential nutrient. You do not need fluoride to be healthy. You do not need fluoride to survive. Nobody dies from fluoride deficiency, and your teeth do not rot and get cavities because you have no fluoride. This is a lie. It is a lie that you are ingesting in your water and your toothpaste, and it is a lie that dentists have fallen for hook, line and sinker. There are too many adverse effects from fluoride to make it worthwhile being touted as a health concern, as something that you should do to remain healthy. Your teeth are made up of calcium and hydroxyapatite. If you get adequate calcium supply in your diet, supported with vitamin D, vitamin K2, and you can apply hydroxyapatite through your toothpaste and mouthwashes to your teeth, you will have a very, very low prevalence for tooth decay. You do not need fluoride. So I do not advocate for it, and I don't believe the dental profession should be, when there are so many implications to your hormonal health, your thyroid gland, your pituitary, pineal gland, your bone health, and much, much more. Many studies now showing that fluoride ingestion lowers IQ. So how can we offset that by saying, oh, but it stops you getting tooth decay, when it's been proven it doesn't stop you getting tooth decay? Okay, let me make it clear. I argue strongly against advocating the ingestion of fluoride. So let's have a look at how fluoride affects the pituitary gland. Now, it may affect the hormones the pituitary gland releases. The pituitary gland responds to thyroid releasing hormone. This stimulates the release of TSH, which acts on the thyroid gland to release the hormones T3 and T4. These communicate back to the pituitary gland. It goes, okay, I've got enough T3, I've got enough T4 in the body, I can stop making TSH. But fluoride reduces the production of T3 and T4 because it interferes with iodine's ability to produce these hormones in the gland, and that is then called hypothyroidism. With low levels of T3 and T4, you're going to be at higher risk of metabolic syndrome. You're going to have low cholesterol levels, which you might think, oh, that's great. But no, you need cholesterol to be healthy. You need cholesterol to protect the nerve. It produces the myelin sheath. You need cholesterol to make your sex hormones and your energy hormones. So without cholesterol, you're screwed. You may end up, if you've got low levels of T3 and T4, if you're trying to get pregnant, you may find that hard. You may find it hard to carry a pregnancy full term, and you may end up with preterm birth. You can have, if you have hypothyroidism in an infant, you get negative impacts on growth and brain development in infants born from a person with hypothyroidism. They end up with what we call cretinism. They have low IQ. So there are issues from taking fluoride, which then, if your thyroid gets damaged, you're going to have a whole cascade of effects. Higher fluoride level exposure results in higher TSH levels. High fluoride levels and low iodine levels mean you're going to have higher levels of thyroid stimulating hormone. So you need to have adequate iodine levels to bypass the effect of fluoride on your pituitary gland. Now, there's a test you can do to see if you're iodine deficient, and that is to paint iodine on the inside of your forearm on a little patch. If that gets absorbed super fast, you are iodine deficient. And then you may need to supplement with iodine, and I would suggest you do that under strict guidance with a naturopath or an integrative GP, because too much iodine can be harmful. Or you can simply add some seaweed to your diet or iodinized salt so that you're getting your iodine that way. What's the effect on the pineal gland? Well, your pineal gland is a gland in the center of the brain's two halves. It's a small your brain's two halves, and it's a small gland that produces melatonin, which is a hormone that is important in establishing your sleep patterns. Fluoride will calcify the pineal gland, and we don't really understand how important the pineal gland is and what harmful effects its calcification has upon it. Fluoride accumulates in the pineal gland and it stops the production of melatonin. There's only a few studies that exist that show that fluoride does impact on the melatonin and then has a knock-on effect to sleep patterns. It has been shown to change the sleep patterns in adolescents, and results suggest that increases in exposure to fluoride through the drinking water can lead to an elevated risk of sleep disturbances and sleep apnea. Higher fluoride exposure affected bedtime and wake time. People fell asleep later. It took longer, and it was harder for them to fall asleep, and they needed more sleep to counter that. So it can have an impact on your circadian rhythm. Then, in that case, you would suspect. And despite these effects of these different hormones, as I've said, doctors and dentists are still recommended fluoride due to its so-called and purported benefits for toothache. I think this is a grave mistake, especially when nutrition, vitamin D, vitamin K2, supplementation, use of hydroxyapatite toothpaste are far more beneficial and effective for your teeth health without the harmful impacts on your endocrine system. So what are my thoughts as a holistic dentist on fluoride? And, I think you should be looking for a holistic dentist to have fluoride-free dental care. You can ask your mainstream dentist not to give you fluoride, but you watch their response. They will roll their eyes. They're going to have a fight with you. They're going to push their narrative, and they're going to make you feel like a freaking idiot or freak because you don't want fluoride. Now, it might be surprising for you to hear a dentist say, I don't believe people need to take fluoride. I stand by my beliefs here. With the development of hydroxyapatite toothpaste, it's completely eliminated the need for even prescription strength fluoride toothpastes and varnishes. There are so many better and modern ways to protect your teeth, guys, than using fluoride. This toxin was introduced to public water supplies throughout the second half of the 20th century, and it's here in Brisbane in our water supply. There's little to no research supporting the claimed ability of fluoride to prevent cavities when ingested. In fact, once your teeth have fully developed, which is by the age of 6 or 7 in your jawbone, taking fluoride, ingesting it, has no impact on the strength of your tooth enamel whatsoever. And it ends up going to other parts of your body. It can calcify your ligaments. It can cause other problems. So consuming tap water that has fluoride in can cause fluorosis, which is developmental and irreversible damage to the formation of your tooth enamel, which makes them mottled and unsightly, but weaker and more prone to tooth decay. There are cancer risks with ingesting fluoride. There are risks to the brain and the central nervous system, and various other disease risks, of which fluoride and thyroid issues go hand in hand. But I think what happens is we've missed the real discussion around the root cause of cavities, and we've put the focus on trying to mitigate the issue by using fluoride. We've got to look at preventing and reversing early cavities. And the best practice are no sugar, guys. No sugar, brush and floss. Yes, I know it seems basic, but it bloody works. And there are other things that you can do to support yourself. If you've got a dry mouth, if you've got low saliva, you are going to be more at risk of tooth decay. So if you mouth breathe, you're going to dry your mouth out and you're going to allow bacteria to increase. So I want you to try taping your mouth at night to help stop you mouth breathing. You can also look about whether if there are medications that you are on that are causing dry mouth as a side effect, and whether you can talk to your doctor about these medications. You can try using saliva stimulating products that are designed to help with dry mouth as well. I want you to eat a diet rich in plants, grass-fed proteins, good nuts, some seeds, and healthy fats, because these are going to help give you everything that you need to have strong, healthy teeth and gums. And if you do cheat and you have something high in acid or refined carbohydrates of sugar, then eat it fast. Don't eat it often. Have only a brief time with it in your mouth. Then rinse your mouth out with some water. And then wait 30 minutes or so, and then brush your teeth. You want to help neutralize the impact of those sugars and acid on your teeth. If you brush too soon afterwards, the enamel has been softened, and you're going to end up brushing that away. You want to incorporate good dental hygiene. You want to brush, you want to floss, you want to tongue scrape, you want to clean in between your teeth, maybe use a water pick, get regular dental cleanings at your dentist. Then there's genetics. There's the on-off switch that will impact your DNA, epigenetics that's called, and that plays a part in your dental health. Now you can influence your epigenetics positively with a healthy diet and healthy lifestyle habits, and that can benefit you, and then you can pass that on to your offspring as well. Yes, not before not after they're born, but before they are, because that has an impact. Your genes, your DNA travels through your lineage. Now, here at Evolve Dental, we want to have the right conversations about your dental health and your oral health. As part of the Dental Zone, one of the things I aim to do is change the conversation that we have around our dental health, because as a holistic dentist, my goal is to help you live a long and healthy life so that you can live filling your years, not your teeth. I want you to have the best possible life, the best possible outcome, and ingesting fluoride and damaging your endocrine system, to me, makes no sense if the payoff, which is the supposed reduction of tooth decay, is so minimal or non-effective. So if you want to have a healthy life, healthy body, then you've got to look after yourself. You've got to lead a healthy lifestyle. You've got to eat well, sleep well, drink plenty of water, and brush and floss, guys. Thank you so much for listening. This is the Dental Zone. I'm Dr. Rachel Hall, holistic dentist, Brisbane, Australia. Give us a call, 0737 20 1811. And if you want to know more about holistic dentistry, safe amalgam removal, toxins, how to care for your oral health, and the impact of your dental health on the rest of your body, then hop on over to holisticdentistry.au or evolvedental.com.au. Do like, do share, do subscribe, do review, let people know about the Dental Zone podcast. And until next time, guys, thank you once again and stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.